So this person brought their dog in. He was paralyzed, still had feeling. You put the PEMF machine on that dog, and in 2 weeks it was walking.
Yes. And
What do
three patients like that.
how do you explain that?
I was super impressed. First of all, it had worked on me. And secondly, it had done an amazing thing in a situation that I thought would be just the opposite. I thought it would make things worse, but it made it better. So I started reading about it, about what it does and how it works. And I was impressed. I mean, it I guess increases oxygen about 200% in the tissue under its influence, which is like, what else does that? You'd have to run a marathon, you know. It increases the garbage collecting cells, the natural endorphins. It increases, well, I guess the big thing it does is like cells that are damaged have membranes that are not permeable, so they won't get rid of their waste, they won't drink water. And so this machine somehow makes those membranes loose again so that they'll drink oxygen and nutrients and excrete their waste products. That is huge. That's enormous. And another thing that it does, and this is very hard to get something to do, it increases lymph drainage. Now, lymph drainage is something that it's just hard to get something to work on that. Like humans, you can jump on a trampoline, I guess that does it. And then there's massage therapists that have been trained to do it. But this machine just does it. And that's just great. It's just wonderful. It seems to discourage bacteria, funguses. It increases the alkalinity of tissue, which most pain lives in an acid environment. So that helps with pain. Gosh, so many wonderful things. So I decided I was going to buy one. But the Magna Waves, first of all, they were more money and they didn't seem as powerful, really, compared to the PEMF machine. So I bought a PEMF machine. It was the great big one they use for horses, you know.
Sure.
And then I kind of went back and forth with Andrew about which machine would be best for my practice, the big one or the little one. I didn't want to spend another big chunk on a big one if I didn't need it. And so we got a smaller unit. I got a smaller unit. I first thought that wasn't going to work out for me. But in fact, it works very well because I find that many of the dogs, which is what I treat mostly now, and cats, do not like the increased power of the big machines. So this works great for me.
So give me an example of what happens. Somebody walks in and says, my dog has this issue. What do you do? What's that look like?
Well, I had one of my first patients that I used this on was an elderly woman. She had no money, and her dog came in, and he was like 18 years old, and he had a big lump in his neck. Okay. Well, you know, we don't like to see lumps in the neck or head. They usually are not good. She didn't have money for a biopsy, so I have no proof of what this was. It didn't seem like an abscess. The dog didn't have a fever. There was no heat or swelling or pus coming from this lump. But she wanted me to do something to fix it. And I thought, well, you know, that's kind of a tall order, lady. But then I thought, well, you know, maybe I'll just use the PEMF machine. So she was willing to do whatever, as she was really like hardcore. You know, she wanted to make sure it was going to work before she did anything. So so I just gave that dog a really long treatment with the small rings over its lump the first time I saw it. And I thought, well, I'll either never see her again or she'll be back. I said, you need to come back in a few days, and we need to do this like 3 times a week to do any good. And I'll make it, you know, I made her like a price adjustment for her budget so that she can afford to come in 3 times a week.
Mm-hmm.
And she came in every, like 3 times a week for 3 months. I couldn't believe it. I thought, you know, wow. And she came from 40 miles away, too. It was a long drive for her. And the dog there were two kind of incredible things that happened. Though, first of all, the lump went down. That didn't happen right away, but it did go down. It took, I think it was every bit of 3 months, but it went down and it got smaller and the dog felt better. And that was the big deal because the dog felt better. And I started using it elsewhere on the body too, not just the neck. I would use it on the neck for a while. Then the dog seemed to have a kidney problem, so I would use it back there too. But the other incredible thing that happened was this dog, I mean, he was like 18 years old. This lady had no money. It eaten terrible dog food its whole life. And its teeth were just like, they were green. There was so much tartar on the dog. So, like doing the treatments was kind of hard because, that stank so bad. So I just held the rings away. But after a while, the dog's breath smelled better. Now that's amazing. I know, because really bad breath in our teeth doesn't come. You can have a lot of tartar and that's unsightly, but it doesn't necessarily mean that you have bad breath from it. It's really coming from the roots of the teeth, which are infected. And this thing was fixing that problem. I thought that was amazing. And then around the same time, I had a little dog who was 15 years old, again, in kidney failure. And what I've noticed is that dogs don't do as well as cats with kidney failure. But this dog also got treatments once a week, fluids and PEMF treatment. And it also went on for a year, did actually better than the cat, more active, unbelievable, really, really good thing. Of course, it's wonderful for arthritis, for dogs that are down in their back. I have had 3 dogs that have come to me in the last year who were paralyzed, still had feeling in the hind legs. I want to emphasize that they were not so paralyzed that they had no feeling. But they had been told, to get surgery, which of course is a great option because it immediately releases the pressure on the spinal cord. So if you can afford the $7,000 to $10,000 is what it is nowadays,
right?
Because they have to do an MRI first and all that. I think that's a couple thousand. All 3 of them, PEMF treatments for 2 weeks, and they were walking again. I mean, we did very regular treatments.
So this person brought their dog in. He was paralyzed, still had feeling. You put the PEMF machine on that dog, and in 2 weeks it was walking?
Yes. And 3 patients like that.
How do you explain that?
Well, once again, it spinal cord paralysis is not always like it doesn't cut the spinal cord in half. It can heal if the spinal cord, if it's damaged, it can heal. This isn't damaged too badly, And so, I can't reconnect one that's been severed, but if it's just pressure, it can relieve that pressure, bringing oxygen, helping the cells that are damaged, lymph drainage, pain relief, all of those things that it does. It just makes things better. Also, it has some nerve stimulation too, which is, the electrical impulses that travel down the, you use it, like I use it almost every day on me. And I've been told I have cataracts. I was told 2 years ago I had cataracts and I needed cataract surgery. Well, I didn't get it. Instead, I use the big rings on my head every day. And boy, I can feel it going right through my eye.
Really?
And I know it is increasing the lymph drainage, which is what cataracts are from. Is from your lymph drainage goes badly, and then you get these big things. So as a result, I haven't had to get cataract surgery yet. Maybe someday, but I can see very well. I don't wear glasses anymore. I can see very well. I know it's helping other things in my brain, helping maybe prevent Alzheimer's. So I use it every day on my brain. I use it on my back. I use it on my whole body. I've got a mat that I can lie on. And
wow. So PEMF has made a big difference in your practice and your personal life.
Yes, it really has.
Did you use this, Sabra, with horses?
Well, I haven't had the opportunity to, is I don't practice on horses anymore.
Okay.
But if somebody calls me about a horse and they want a consult over the phone, I always tell them to find somebody who does it in the area and use it. I bought a unit. My daughter lives in California in the mountains, and she has a horrible drive every day just to get to town. And it's a bumpy drive. And she had a fracture in her collarbone that never healed properly.
Mm-hmm.
And she's works on a lot of physical work, and she's sort of raises plants and farmer. And so she's always digging and hauling and lifting, and her shoulder hurts all the time. So I bought her a unit for her just to have, and she uses it every day. And she's just will not part with it. You know, I said, if you're not using it, give it back to me. And she goes, no.
That's great. So summarize for me, if you would, how has PEMF technology helped you and your practice?
Okay, well, it's given me a wonderful tool that I can use on almost everything. And a tool that improves things I didn't think could be improved before. I don't treat humans, so I don't know how it does with, ALS or cancer or anything, but I know in animals it helps with things that I thought I couldn't help that much.
Wow.
So I'm really impressed.